Dr. Dela, we are so thankful to have you joining us because it's been entirely too long.
Oh, I missed you guys so much. I'm so glad to be here with you.
We honestly miss you every day.
Yeah, we do.
It's the truth.
It is the truth.
It is the truth.
Likewise. You
So,
guys bring the most cheer to my life, so.
and vice versa. You know what does not bring the most cheer to my life? Hair days like this. Because we're truthful about this. Because this is COVID. This is the time of COVID, and this is what happens. I don't have time during these COVID days to do any but this much of my hair. So there's this new reality we're all everyone talks about, oh, this new normal. When the new normal comes, there is just so much. There's so many new cases, so many new deaths, so many closings, so many reopenings, so many wearing masks, so many not, and the list goes on and on. And so there are so many questions still about COVID-19 and so much confusion on how do we get through this pandemic, especially when we have politicians disagreeing with one another about how to proceed and mandates constantly changing.
Yeah.
Right now, as our trusted medical expert, Dr. Dela, what would you say of all the craziness going on? What are 3 things that every American can and should do to be part of a solution as opposed to the problem?
Yeah, that's like the $1,000,000 question, right? We just want to know what to do to make this end. We all sort of have this COVID quarantine exhaustion, I think, and it's wearing us all down, even those that completely firmly believe that staying at home and isolating and quarantining and wearing masks and doing all that, is really effective. Even those folks are getting worn down. And so I think, it comes down to the fact that we, unlike the beginning of the pandemic, where, this virus was growing and every day we were growing with it. We really didn't know anything. And now we know a lot. And, watching the evolution of this virus, we've seen how it's played out in other countries. We've seen how it plays out state to state when different interventions are put in place. And so I think first and foremost, as hard as it is, and I know there's, mixed feelings about leadership and where we need to look for information and how we should feel about it. I think most importantly, we need to really realize that this is a virus, not a political issue.
Mm-hmm.
And I know that's hard. I know it's really hard to not look at this as a political issue. But wearing a mask is not a blue state problem. It's not a red state problem. Doing social distancing, keeping 6 feet apart is not a political, religious, or otherwise, tough issue. This is really about, this is a medical issue. And so listening to the scientists, the researchers, the doctors, the ones who do this for a living, really letting them lead the charge. Because in other countries where we've been able to do that, we've really seen a really sort of beautiful decline in those numbers. And that's what we need here. So I always go back to what we already know. Mask. Okay. We already know this. So, I don't want to beat it down anyone's throat, but it just really just needs to be said again. So when we wear the masks, we can go through tricks about tying off corners and puckering in sides, and then that way it puckers out and becomes more of that N95 shape that people like, or getting all the cute cloth ones that people sell everywhere. There's really no shortage of them. And if it's still a financial barrier, you can go back to the double layer cotton t-shirt with the rubber bands and still make them at home. But the important thing is to wear them properly. So wash your hands before you put them on, because again, your hands have been everywhere. And if you're touching your face while you're putting your mask on or touching the inside of the mask, it defeats the point. So you put it on. And my beloveds, you keep it so it covers the nose. Now, I know it's crazy that I have to say this, but the majority of the people I've seen recently wear it something like this because they're talking.
Right.
They have it up here and
Right.
move it out of their face while they're eating. I've seen some nice chin straps. I've just seen the gamut. Of course, you do this when you're talking. And I think one thing that I've realized is people sort of don't want to be rude. It's actually really comes from a really beautiful place. They don't want their voice to be muffled. They want to be able to be clear with their communication. And so they'll be close to someone and they actually move the mask to talk because they want to
Right.
be clearer. But that's the space that you really have to be careful and you have to keep it on in that space. So that's the most important thing is going to be the mask and the face cover. Recently the CDC, along with the Surgeon General and even President Trump, have re-emphasized the importance of wearing the masks and face covers once again. And again, I know that it feels hard to breathe as a surgeon and as someone who's in procedures all day, even before it became mandated. I lived in these, for 12, 18, 24, and 28 hours at a time. I guarantee you I was able to breathe. It's uncomfortable, but it doesn't, bring your oxygenation down. It doesn't actually impair your breathing ability. So, it's uncomfortable, but please, please wear the mask.
Yeah.
Um, Another simple thing that I think people were really, really good about was hand washing. So, if you bring your minds back to March and April when things were heightened and our emotions were heightened about COVID, you couldn't find a person out and about that didn't have hand sanitizer on them. Couldn't find a person that wasn't in the sink for the full 20 seconds. And I have to tell you, I haven't seen that as much anymore. So, just a reminder that that is sort of just good hygienic practice no matter what season we're in, whether or not COVID comes and goes, whether or not we enter flu season. That's really just a really great way to minimize your exposure and to not pass around this virus as much. And then the third is also what we already know, and it's trying to maintain social distancing. So I know that's hard. I miss my friends and family just like everyone else does. I miss you guys. I wish I could come up and hug you and squeeze you and be around you. But the reality of it is, people have gotten a little bit lax. Not everyone, but we've sort of expanded our quarantines, and you sort of feel like, okay, well, I already see my work people when I'm at work, so I'll hang out with them at a bar or restaurant afterwards. And then, oh, but I've already seen my parents and my grandparents and they're fine. They haven't gotten sick so far. It's been 6 or 7 or 8 months now. It'll be fine if I was just with my friends and then back with them. And then, oh, well, I am outside at this brewery that's now open again, and this vineyard that's now open again, and this beach that's now open again. And people, I think, when they're outside, feel um, a sense of comfort. And I'm afraid that it's a little bit too much comfort, because we think that we're outdoors and we have good circulation. And that's true. It is more likely to get COVID in, indoor spaces with poor ventilation and when you're closer together. And so being outside is helpful, but it doesn't make you immune to getting it. And you really still are at risk in those spaces, particularly as those crowds increase. And again, as we're hopping from one quarantine to another, you're still passing on the potential of that exposure to each one of the people you come in contact with. So I know it's crazy to be this many months out and to have the same 3 steps being just as important now as they were initially. But, if it's not broken, don't fix it. These are the steps that other countries are taking very seriously and that have worked.
We thank you and we appreciate you. And we're
Oh,
so happy that we have a trusted medical expert because
it's my pleasure.
we're so we're so winning.
Wash hands.
And wash my hands of it.
I'm joking.
Dirty.
I think also the reality is that you can kind of look across the states and you see that, for example, the states that reopened a little bit before others did, they did end up seeing the rise of this first wave peak even more. We're at a point right now where I believe it's 40 different states have seen hospitals being overfilled again. And I know sometimes it's, if you don't see it yourself, if you don't feel it yourself, if there's no shortages around you, it's sort of hard.
Mhm.
We can all be empathetic, but it's almost to a point, right? It's hard to really, really internalize what's going on in other parts of the country when you might not be facing it personally where you are. But the reality of it is that we know that we don't have, a real treatment yet. We don't have a cure. We do have 23 vaccines that are in the human trial phase, which is really good news. But again, the earliest we could expect to see a result is probably springtime. So we're really far out from where we can feel safe and, not in a fear pushing kind of way, but safe from um, controlling the virus really in a manageable way. And really, even once we have a vaccine, we have to get it distributed and dispensed to all the people. And so we just have some time before we get there. So what we can do is really just try to slow down the growth, get out of this first wave, try to really start knocking it down because the numbers aren't lying. I mean, the hospitals are full again, and it's not everywhere and it's not every hospital, but it's in the majority of states, and that's really significant.
Right.
Right. And it is true, if you test more, you get more positive results. But just think about the people we aren't testing, all the people that aren't even going.
Right.
I mean,
Mm-hmm.
if I felt a little sick, I probably wouldn't go get tested. I would probably just self isolate.
Mm-hmm.
Do you know what I mean? And I'm sure that's
Yeah.
majority of the case.
Yeah.
Yeah, so the testing phenomenon has caused a little bit of confusion, I think, and has led to some of this political debate back and forth about what testing truly means.
Hmm.
But there are a few realities about testing. One of them is that we could still use more.
Mm-hmm.
Testing really helps us not only identify cases, but can often help us identify if there's an outbreak in a certain area, if it'll help us with contact tracing. It helps us with a lot of aspects of disease control that really would help, control the outbreak or the control the virus in the pandemic. So there's a lot of uses for testing. Now, doing more testing, tests can't become positive on their own. So if we're testing people and they're positive, they were already positive, and we're capturing those people, we're able to quarantine and isolate them and their family members and the people that they've exposed, and then minimize that growth by whatever factor we've been able to prevent. So realistically, I know that the idea and premise of it feels like if we test, we'll catch these people, but really they already have the virus, right?
Mm-hmm.
If they're testing positive, they have the virus, and you really want to control how many more people they infect. So testing is really just a positive thing. We really should test as many people as we can.
Mm-hmm.
Symptomatic people, of course, and then people who think that they've been exposed and really have access to that. Believe it or not, even though we think we're over testing now, there's still places that don't have adequate testing
Mm-hmm.
available.
Right.
And I also read a survey without, I don't know the exact numbers, but I know it's like 1 out of every 6 Americans are being tested. And in another country where people are like, well, other countries aren't testing as much, it was 1 out of 8. So the disparity isn't that much. So is there something that we should be doing to model their behaviors, you think, opposed to what we're doing now? Is it just the 3 things you've mentioned?
I mean, no, there's a slew of things. I think it's hard to say how to follow any one country in particular because of course within each country you're dealing with a lot of different dynamics. There's different population sizes, different population densities, there's cultural norms. I mean, there's a lot of countries where it's common courtesy to wear a mask or a face cover if you have any sort of upper respiratory viral illness. So there's already a sense of distance. There are a lot of cultures where touching and hugging and things are already not a part of the traditional greeting. There's schools that already had dividers, and a lot of other things were already in play there. So it's a little hard to say that we should just overnight catch up. I mean, there's a lot of infrastructure that has to go into place, a lot of um, money, a lot of organization, a lot of coordination. And so I think it'll take time, but I think looking to see what other countries have done that has been successful and seeing how we can implement it here would be the best of both worlds. I mean,
Okay.
right now the biggest decision is really the reopening of schools, and how we can make that decision while also dealing with the economy is a really, really important decision that has to go on here. And, there's a new stimulus package that's being considered, and whether or not what percentage is going to go directly to people, what percentage is going to go towards testing and the CDC, which there's been some debate about that number coming down. And, so all of that is gonna play a part.
Well,
Absolutely.
we thank you for being at the front line. Not only so this was the other question. This is more personal.
Okay.
This is because you have served on the front line. You've been healing patients as a doctor, and then you've been online, like publishing content as a medical correspondent. Like, what? Two questions to that is, what has been the hardest of those two roles, and then what has been the most rewarding?
That's a tough one. First and foremost, I would not even start to consider myself being on the front line. My colleagues who are in COVID units wearing, 2 layers of masks and face shields and moon suits essentially to be able to do their jobs. That is truly the front line. Those are the heroes in my eyes. And, I bowed down to their sacrifice, and it's just an honor to be a part of the field. I've sort of been considered essential this whole time. And so I have been working and therefore exposed to a lot of patients with COVID-19. And then we've done a lot of testing sort of in the preventive medicine context. I was doing a lot of testing so that patients and actually hospital employees, the nurses, the doctors, the techs, the phlebotomists, all the staff and all the support staff, so that they could stay safe and healthy and well, so they could work and take care of everyone else, which was just an honor to be a part of. And then, of course, in the medical journalist role, I've been able to just do this deep dive into the COVID-19 world and try to do my part as both someone who has a public health background and who is a physician and who can kind of marry the two and try to help with some of the conflicting information and some of the confusing terms and sort of try to make that easier to swallow. So that's also been really gratifying and amazing, because it's sort of disseminating the information that is otherwise really hard to get across unless you're one-on-one with a patient. And then now I'm back to doing clinical work. And then so I'm with my patients again, which has been amazing. And, I think each one of them have their own challenges. I think honestly, for me, the hardest part has been just this fear I have, this constant underlying fear that keeps me up a lot, and I toss and turn because I have parents that are not as young as they used to be, and I am potentially exposed every single day, and I am humbled by the honor to take care of patients, but it's also, all of us that are doing that have families to come home to and people who we want to keep safe and protected. And um, you can be asymptomatic and be a carrier. And so even though I get my temperature checked every day at work, and even though I'm very mindful of any symptoms and I'm very careful in prevention strategies, I still have the fear. So that's been really hard.
Mm.
I think the human contact part has been impossibly hard. Um, we have made some accommodations and adjustments for seeing certain family members and not, and trying to do it in a socially distanced way and doing it in a yard or a boat, or everyone tries to find their sort of sliver of excuse of how to get through this, and I am no exception. But I'm just really kind of, I don't know, it's really hard not to be able to see your loved ones and be around them. And if you're single, it's hard to date, and if you're married, it's hard to be quarantined in the same space. There's a challenge no matter what your what your circumstances are. And I think, I wish that wouldn't divide people. I wish that would actually bring people together, because for the first time in at least my sort of memory of circumstances we've been through, we're all going through the same thing at the same time. And yeah, it looks different for everyone. And, someone who's lost a loved one to COVID-19, and someone who's lost a job, and someone who's lost, their mental health has,
Right.
been lost in that. I mean, there's so many different battles and struggles. And so not everyone's experience is going to be the same,
Mhm.
but we are facing the same thing. And I just, I know you guys put everything you have into finding the unity and the space that we can connect, with these shared experiences. And so I'm still cautiously optimistic that we can find our way out of this and find a reason to come together instead of, unfortunately, a lot of what's going on, which is pulling apart.
Well, we
Right.
have to.
Right. Yeah.
That's the only way forward is we have to,
So,
for sure.
Yeah.
That was
No,
beautifully
it's,
put.
oh, thank you.
yeah.
Yeah.
No, thank you. And thank you for all you've done and continue to do. And we would hope that, I mean, we would invite people to please just to stop for a moment and to look around at all the sacrifices that have been made by so many, to be part of a solution, and not part of the problem. And for people just to be mindful of that. And again, it's not red or blue. I mean, we're freaking purple right now, like this is just, we're all here in the middle of it. And you're right, it's the first time in human history all every human in this planet is
Mhm.
touched by the same thing, and that's incredible. And what an
Yeah.
opportunity it is for us to rise,
Hmm. I mean,
right?
this is right in
Yeah.
history.
this
Right
this
now.
is this is
Right.
a moment, this is a moment for us to make a choice and to choose a side. Let's choose a win and to work together. So
On so many levels, actually.
we appreciate
Absolutely.
your work that you do so
Mhm.
much. And Jack and I were talking the other day. Number one, we are, again, so glad you're part of our family. So honored that you are our official ambassador for heart disease awareness. You are our trusted source for a gajillion things, but
Mhm.
certainly on the medical side, we're like, what's Della say about
I love you guys.
it?
Thank you.
So there are these things, but right now, I think for people to find comfort
Hmm.
amidst all this chaos, it's to find a voice that resonates, to find someone who can, the way that you do it, Della, the way that you say, hey, these are issues. And I love the way that you will bullet point them. That point A, B, C, D, E.
Yeah, I love
But
that.
then say, here, these are the things. I'm like, oh, but say, but here are the things. And then you provide the solutions.
Hmm.
Say, these are the problems and these are solutions. And so it's always addressing with honesty what's wrong, what's happening, what we need to address. But then you go the extra mile and you address it.
Hmm.
And you do it with a smile. You do it in a way where we say, but hey, this is how we can help. Because we all need to be there. We, number one, need to be aware,
Hmm.
and then we need to be able to take action. So I think what Jack and I would like to say to you and to make other people aware of is that there are actions that we can all take,
Hmm.
each and every one of us. And we appreciate you. We are thankful for you, for making that available to all of us.
Oh, it's my pleasure. I'm thankful for you guys. It's your platform and what you guys do and you devote yourselves to is just, I mean, so inspirational for me. And to even be a sliver of a part of that big dream is just, it really has been amazing for me. And I think you guys do for so many different um, nonprofits and so many different um, dreams you're making come true by taking these bites out of the problems and by making it very real and bringing people who really care about the topics together, to uplift these dreams and these goals. Because I think, to your point, it can be really kind of scary and overwhelming out there. And if we don't kind of chop it up and give solutions and understand how overwhelming it is, then it's really hard to do anything about it. And I think that's something you guys do so beautifully is that you make it clear that there's a voice for all these problems and that there are things we can do about it and becomes so much less scary that way.
Well, and it's, I mean, a very good example that I still think about is when you had done a post about if you get pepper sprayed while you are at a protest rally, these are steps A, B, C, D. I'm like, this is good information.
Yeah, unfortunately, learned from getting pepper sprayed at a protest.
You did, and so that you lead by example, and that you provide a protocol of positivity for people to follow, to say, this is how we're going to get through this. This is how we're going to get through this together. And thank you for your kind words about what Jack and I are doing, what all of us are doing with Awareness Ties. It's building
a stage.
This stage. But how good is a stage? A stage is only as good as who stands on it. So thank you for standing on the stage.
Thank you.
We love you. We appreciate you. And we thank you so much for your time and all of your insights. And we are hoping with this to share this with so many who will become more aware, and who will be inspired. And we thank you.
I love you guys so much. I would stand next to you for anything.
Right back at you. Thank you so much, Dela.
Thank you guys.
Appreciate you.